So today we're going to be doing some patient education because we did a plaque score on you and your plaque score was a little higher than we would like it to be. If you look here, you see in between your teeth are stained a little bit darker purple than the rest of your teeth, and then up towards your gum line, right around your teeth is stained a little darker as well. That's because the disclosing agent is going to stick more to where there's plaque accumulation, which is bacteria, and that's where it's accumulated more. So that's a sign of maybe missing those areas when we're brushing and flossing. So we're going to go over why plaque is bad and why we want to remove that as soon as possible, and how that could be leading to some of the redness of your gums and the bleeding that we saw when we were doing our exam. So plaque is normal bacteria that's in our mouth, starts to grow, and that's due to the foods that we eat. So if we're eating sugary foods or starchy foods, that's going to give the bacteria that's normally in our mouth, it's going to give them more energy and help them grow, and then those are going to be once they're left undisturbed, they're going to start causing some inflammation in your gums because your body's like, there's too many bacteria, I don't want those in my mouth, and so your body's going to start to try to fight those bacteria, and that's going to be the cause of what this redness is along your gum lines that we're seeing. So plaque is the cause of periodontal disease, and it is going to initiate our host response. So it's not just the microbes in our mouth, it's also our body trying to fight off the microbes that is going to lead to the progression of periodontal disease. So how plaque is going to turn into a cavity is we have a buildup of plaque in our mouth, and then the acid with our diet combined with the plaque is going to start breaking down our enamel, and that's going to lead to the holes and cavities in our teeth. This chart here is kind of the start of when we're maybe having some incomplete or infrequent brushing all the way to irreversible periodontitis. So we start by maybe missing some spots, usually in our posterior, in our back teeth, in our molars. Maybe we're missing some areas or not brushing as frequently as we should. That's going to give plaque. That's going to plaque is just a buildup of our natural bacteria in our mouth. And so the bacteria is going to accumulate. That's going to become what's known as plaque. Our bodies are going to try to fight off the plaque. And so a host response is initiated. Our body's like, let's get rid of it while we can, but that's also going to start breaking down our own tissues in the process of trying to kill the microbes. And so that's going to lead us to our next stage of periodontal disease, which is gingivitis. And in gingivitis, that's when you see the reddening of your gums. That's when we're getting some bleeding on probing. That's when maybe it's a little more sensitive than it has normally been. That's the beginning stages of gingivitis. And then we get into a very critical area, and that's when we can reverse the periodontal disease or it's going to progress into periodontitis. So the ways that we can reverse that is good home care, regular office visits, making sure we're removing all of the plaque and biofilm in our mouth, and in just a matter of a couple of days of improved oral health care, our tissue will return to normal. On the opposite side of that, if in that critical area no changes have been made, we get into periodontitis, and that is whenever periodontal disease becomes irreversible. So we're having bone destruction, we're having periodontal ligament weakening and destruction, and then once it's to that stage, it's typically oral surgery that's going to help get us to a healthy dentition. So I have some aids here to show you what the plaque score that we did what that's meaning, and then how healthy gums should look all the way up into the final stages of periodontitis. And so if you look here, this is a picture of a mouth that has some light inflammation here on the bottom. What you can't see is all of the plaque that's actually on it, and that's why we use the disclosing agent. And so once it's disclosed, you can see all of these stained areas is showing us where there's accumulation of the bacteria on your teeth. And so that helps us determine areas that might need some more focus during our cleaning, and to help aging as well, and maybe some methods that we can use, and we'll go over those shortly. This here is also a picture. If you look, the gums are healthy, they're pink, they're stippled. If you look up towards the top picture, your gums are nice and tight around your tooth. Once we get into gingivitis, you can see there's a reddening around the teeth, your gums are a little more red, there's some inflammation starting, and then this yellow here is the plaque that's accumulating on your tooth, and then your red gums in response to the plaque. Once we get into periodontitis, that's when we're getting bone destruction. If you can see, the bone levels here are starting to break down. Our pockets are increasing, and there's more inflammation around your tooth, and the plaque is just coming down into the pocket that's holding your tooth. And then once we're in advanced periodontitis, there's advanced bone loss. You can see the bone levels here in comparison to the bone levels in a healthy mouth are significant. The inflammation is significant. The pocket depths are very deep. The plaque is coming down the root surface now, and in this stage it's possible to have tooth loss, and so that's why we need to catch it here in the early stages of gingivitis when there has been no bone destruction, so that we can reverse it and get you back to a healthy state, because it is very hard and it's impossible to reverse periodontitis. So we need to make sure that we don't get to those stages. So plaque luckily can be removed at home just with daily brushing and flossing. And if plaque is left undisturbed, it's gonna harden and turn into calculus, and that can happen in just a matter of days. Calculus can only be removed by dental professionals, and so that's why we want to keep it at the level where it's able to be removed at home, because once it hardens, then you have to come see us. And we do love to see you, but if we can prevent you from getting calculus, that's going to be beneficial to your oral health. And then calculus has a whole bunch of little pores, and that's going to make bacteria even easier to accumulate. So the bacteria is accumulating, it's not removed, it's hardening into calculus. The calculus has pores, and the bacteria are just filling in those little pores. And so it's accumulation on top of the accumulation. So we want to keep it from reaching that level. So diet and nutrition definitely play a big role in the formation and accumulation of the bacteria in your mouth. So sticky foods, foods that are high in sugar and carbohydrates, those are all breaking down into sugars, which the bacteria love. So that's going to add fuel to them. That's going to help them multiply. The quicker they're multiplying, the more it's going to be sticking to your teeth. And then if we're snacking throughout the day and not brushing in between those snacks, which if we're constantly snacking, it is harder to pick up a toothbrush and floss, and every single time we're doing that. So we do recommend that if we're having those sugars, which is fine to have sugary foods or sticky foods, we just want to do that all at once. So if you have a box of M&Ms, let's just eat the M&Ms. We're not going to spread them out through the day, because if we're spreading it out through the day, that's giving your bacteria food throughout the entire day. Instead of a quick burst, we're going to brush it off, it's out of the mouth, and then the bacteria isn't snacking on that food all day with you. And then acidic foods and drinks can also start to break down your enamel. So the sodas and the things that are high in acids, we want to be careful, because that's also going to lead to our enamel starting to break down. Luckily, toothbrushing is the #1 preventative for oral disease. So we want to find a toothbrush that is soft, that has round-ended bristles, that is nylon, and multi-tough, and we want to make sure we're replacing that toothbrush every 3 months to keep it fresh. So once we find the toothbrush that's good for us, we're going to make sure that when we're using that toothbrush that we have a light grasp, that we're using overlapping strokes, that we're brushing at least twice a day for 2 minutes, making sure we're getting our tongue, because our tongue does hold a lot of bacteria. And then we're going to pick a sequence, so maybe we start molar to molar and the same for the bottom, but once a day we're going to vary that sequence, because sometimes we start out a little strong over here, and then by the time we're here it's a little weaker, so we're not removing the biofilm as much. So maybe in the morning we start here, and then in the nighttime we start on this side and go back around, so that way at least once a day every surface is getting a thorough brushing. And then there are some toothpaste, and you can kind of customize the toothpaste to what you're looking for. And so if we're wanting to remove the bacteria, lower the bacteria load, we want to find a toothpaste that says triclosan. If we want to reduce our caries risk, we're going to look for one that has a sodium or a stannous fluoride. And if we're having some sensitivity, one that has potassium nitrate in it would be a good toothpaste to look for. And also we want to make sure that it has the ADA seal of acceptance. And so since you do have some sensitivity with your teeth, I am going to recommend, so this is a Sensodyne toothpaste. It does have fluoride in it, and that's going to be a little bit more gentle on your sensitive teeth. There also is a Crest gum and sensitivity toothpaste. This is also a good option because it's killing the bacteria. It's also closing up the tubules. It's going to cause some of that pain. So it's closing those up so we're feeling less pain. And then for the recession, it is going to help shield the exposed root surfaces. So either of these are good options. They both have fluoride in them, which is what we want to make sure that we have. And then, you are drinking city water? Yes. That's good because that does have fluoride in it, and so that's giving our body fluoride throughout our system from the inside of our teeth out. But also we can help give our teeth fluoride from the outside in. So that's why we do fluoride treatments in the office, like we have varnish, which I would recommend a fluoride varnish for you since you do have a little bit of recession. The varnish can actually be painted a little heavier on the areas that have the recession, and that isn't available with the other methods like a gel or tray method. But with the varnish, we can make sure that we're hitting the recession a little bit heavier. So I would recommend a fluoride varnish for you. Also, every day we want to make sure that we are using a mouth rinse. Listerine is a great mouth rinse to use. So this is an example of how we're missing some of that bacteria disruption when we're just brushing. This here you can see is a little bit less red. So this is with brushing and flossing. But it's really that brushing, flossing, and mouth rinse combined that's going to get the most benefit. It's going to get all of the interproximal areas, which is in between your teeth. It's going to actually go down into your gums a little bit and kill the bacteria a little bit into your gums. And so it's the combination of the three combined that's really going to give you the most benefit for daily at-home care. And then, so let's talk about some brushing methods. Would you mind showing me what you're doing at home now, and then we can see maybe some potential modifications that we can do? Okay, so that looks pretty good. But we want to make sure that we're getting right at the gum line, which is where you had some darker staining. And so we're going to angle our brush at a 45-degree angle like this, and we're going to vibrate for about 10 seconds, and then we're going to brush down. And that's going to help get into the gum line, and it's going to cover the tooth surface. And we want to do that for all surfaces of our teeth, making sure that we are on the gums itself, because the more stimulation that our gums receive, the stronger they'll be, and the stronger our gums are, the harder it is for bacteria to invade those gums. And so we're going to do that all around our teeth. We're at the angle, we're brushing down, making sure that we're getting the biting surfaces of our teeth, the insides of our teeth, and then brushing our tongue at the end. Okay? Did you want to try that and show me? Sure. Much better. I think that is going to help for next time when you come in. If you're brushing like that consistently, then we are going to see a lot less of that stain at the top of your gum line. And then the next thing we're going to talk about is flossing. So when we're flossing, we want to make sure that we are hugging each tooth, which is really where the benefit comes in. So we want to wrap it around our fingers, and we're gonna seesaw it down, and then once we're down into that little pocket, we're gonna hug the tooth and pull back up, and that's gonna help pull the plaque and germs out of our teeth. We don't want to snap it down, because that can actually cut your gums. So we're gonna just very gently slide in with the seesaw motion, make a C shape hugging the tooth, and then pull it back out. Okay, did you want to try that? Sure. Yep, exactly. Yep, and then we're just going to do that, making sure we're hitting every tooth, and then on the back molars as well, we're just going to hug around the back, our back teeth as well, making sure that we're not missing that area just because there's not a tooth to squeeze between. Okay? And then, so flossing definitely is an advantage to your oral health routine, but sometimes we might need some other aids. So, there, as you can see here in the slide, there's a multitude of auxiliary aids that we can use with our brushing and flossing. This is a brand called Tepe. This picture here is they're showing of a normal floss, and while it is getting in between the teeth, it is missing some of those curves that a tooth has naturally. And so that's where one of their interdental brushes could come in. And so they do make them in a variety of different sizes to fit every space that we need to fit. Because you don't want to force a thicker brush into an area that it's not meant for, that's too small, because then you're going to create, you're going to push down your gums and make a space where there doesn't need to be one. So this brand makes a multitude of brushes for all dental needs, so maybe we can talk about looking into those. You did have some areas in the back that had a little bit of embrasure spaces, we call them, where the gum line is down a little bit, and that would be a really good area to use those interdental brushes. And so I look forward to seeing you back at your next visit and seeing how those changes have given you a lower plaque score. I'm excited to see less of the darker purple on the gum line in between your teeth, and that should also bring down the redness that your gums are having right along your tooth line and help with some of the bleeding that we had today with the probing. Okay, do you have any questions? No. Okay. Thank you.